We also have to consider the legal aspects of safety and health. So there are laws available, such as Factory Act, such as the gas cylinder rules, such as Petroleum Act, such as Battery Act. So there are laws related to various safety and health related aspects. We have to follow those laws. We have to identify those laws, and we have to make a process and people responsible for ensuring that the compliance to such requirements are taken place. OHSAS 18001 also talks about other requirements. Some of the requirements may not be legal, but they are related to health and safety given by some interested parties, such as there may be requirements of union, there may be requirements of industries association, there may be requirement of maybe like nearby companies, nearby localities, gram panchayats, related to health and safety, which are not the part of legal system, but they are important because these other interested parties are also to be taken care. So in the OHSAS or health and safety management system, we have to consider the legal as well as these other requirements and align these requirements with the hazards which we have identified. Once we have done these initial studies of hazards, then we have to make some objectives related to our health and safety performance. The objectives can be minimization of accidents, minimization of near miss, improving the health of the people, minimization of health related problems. So such kind of objectives should be taken and the target should be taken. What is the level of from which level, like we were having suppose one accident in say 1000 days of working, we want to make it 0. So that kind of targets. And again, we should have an action plan to achieve those targets. Those are called programs, safety management programs or health management programs. How we will be achieving that program, that there will not be any accident even if we work for 10,000 days. So that kind of action plans. The another aspect of implementation of health and safety management system is defining clear responsibilities. People should be competent. Those people who are having experience in operating the equipment, operating the plant, handling the material, handling the processes should be given the responsibilities. Because untrained people cause accident for themselves as well as for others. So there is a process of training. We have to give training related to hazards to everyone. We have to give the training related to the emergency preparedness. We have to give the training related to their responsibilities, what they should do, what they should not do, what are the consequences if they do the operations or processes in different way, what are the safe limits of various equipments, various tanks, various pressure vessels. So such kind of things should be given awareness about the health and safety management system. We also have to have a system of external and internal communication. So there should be an internal safety team who should meet periodically and discuss about what are the improvement possibilities in various departments, in various processes related to health and safety. This team can also investigate any accidents, any incidents, any near miss which has happened. And like that they should have the agenda and review minutes of meeting. There is also a requirement of external communication. How we will be communicating with the nearby factories, the factory association, the legal authorities, the customers on the safety related matters. We have to take a decision whether we will be informing what kind of hazards are there in our company to the external people. And if we decide to inform these hazards, how we will be ensuring this communication. We have to inform to the nearby hospitals what kind of antidotes are there for the chemicals which we use. There is also a requirement of participation and consultation. In safety related matter, we have to ensure that the workers also participate, supervisors also participate, various level of people also participate. Even suppliers and external people also should be participated, so that there is no safety related aspect which is undone. And we have to consult workers. We have to consult the people who are supposed to follow the particular procedures. Like suppose we decide to buy some safety shoes. So we have to consult the workers whether the safety shoes are comfortable, are they light enough, are they strong enough. So that when we purchase so many safety shoes and give to them, there should not be the situation that people say that no, this is not the right shoes, and then we waste a lot of our financial resources. In the implementation, there is also requirement of documentation. There should be a safety manual, Apex manual, which should talk about how our company has adopted OHSAS 18001 requirements. This also talks about the common procedures such as how to identify the hazards, how to do the communication, how to do the trainings, how to do the various safety related activities such as monitoring, such as incident investigation, how to record the evidences related to safety, how we record the accidents, how we record the testing of various pressure vessels, material handling equipments, ropes. So such kind of templates also should be prepared. And whenever we have document, we have to control the documents. That means right document is available at the right place at the right time. Another aspect of implementation is the operational control. Operational controls means writing do's and don'ts, what we should do, what we should not do, which could lead to accident. So such kind of things we have to write in the operational control procedure. Some of the procedures may be related to the suppliers, or maybe the external people, or the contractors. So we have to make the procedures for operations control. Another aspect is the emergency preparedness. How we will ensure that any kind of bigger emergencies like explosion of boiler, explosion of a pressure vessel, explosion of gas cylinders, fire, earthquake, heavy flood, heavy rain, how we will be handling such situations, accident of a tanker or truck. So how we will be ensuring that we are prepared for taking care of any emergencies. First of all, can we prevent such emergencies? What are the steps we will be taking? And if we come across such an emergency, who are the people who can help us? Which are the nearby hospitals, nearby fire brigade, nearby companies, fire systems where we can take their help? How many people are trained to use fire extinguishers? How many people are trained to provide the first aid. So we have to test all these preparedness in the form of emergency drills. The next aspect of safety management system is monitoring of the performance. So we have to monitor some of the parameters. We have to monitor what is the noise level in our company. We have to monitor what is the dust level in our company. We have to monitor what is the illumination levels in our company. So such kind of key characteristics related to safety should be monitored. We have to monitor the health checkup. And we also have to monitor our continual compliance to the legal requirements and the other requirements. We have to ensure that we comply to these requirements in a continual way. Periodicity should be defined. Procedures are required for doing this kind of monitoring activities. There is a requirement of incident investigation also. So we have to involve the right people for the incident investigation. Do a in-depth analysis. What went wrong? We can use such tools such as 5-why analysis or cause and effect diagrams or any other techniques. We have to understand and we have to take actions how to prevent such actions in such incidents and accidents in future. Whenever there is an incident takes place, either it can lead to health or safety deterioration, that is called an accident. And if an incident takes place, but the safety or health has not affected, but it has potential to affect health and safety, that is called near miss. Near miss means some object has fallen, but it has not fallen on any person. It has damaged machine, no problem, but it has not fallen on any person. So there was no safety accident, but it is called a near miss because it could have damaged some persons. So we have to have the procedures for investigating such incidents which has led to accident or which are near miss. Also, there is a requirement of identifying the non-conformities related to the health and safeties. How many people are below the health standards? Whether the material is properly kept or not. Whether the fire extinguishers are tested or not. Whether the noise monitoring is done or not. So all such non-conformities are to be identified and then corrective and preventive actions are to be taken. Corrective actions are taken on the non-conformities which has happened, and preventive actions are taken which are the possible non-conformities which has not happened but there is a possibility. So for preventive actions we have to use the hazard analysis and study the processes, study the equipment, study the processes, and like that we have to take the preventive actions. Another two requirements are related to internal audits and management review. So there should be periodic internal audit by qualified auditors, and there should be a process of recording the non-conformities, recording the audit findings, completing the actions, having a follow-up audit, and ensuring that the non-conformities are taken care well. Finally, there is a requirement of periodic management review by the top management with the help of HODs with respect to what is the performance of the company with respect to health and safety. Suppose we are monitoring a period of 3 months. So how many accidents happened during 3 months? How many near miss has happened during 3 months? How many trainings has happened related to health and safety during 3 months? So all such kind of like legal requirements, participation and consultation activities in the company should be discussed at the top management level. Thank you.